Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Isoflurane. Isoflurane is an irritating agent. Systemic effects of isoflurane are mainly on the cardiovascular system. On cardiovascular system, it causes minimum decrease in cardiac output. It can be used for it preserves the baroreceptor reflex. Because it preserves the baroreceptor reflex and it causes minimum decrease in cardiac output. So isoflurane is the agent of choice among inhalational anesthetics in cardiac patients. Agent of choice in cardiac patients in intravenous anesthetics is etomidate. There is no coronary steal phenomenon in isoflurane. It is also inhalational agent of choice for experiments also.
Summary: Isoflurane is an irritating agent, so it is not used for induction. So CVS symptoms: it has minimum decrease in cardiac output and it preserves the baroreceptor reflex. So it is the agent of choice for cardiac patients and it has no coronary steal phenomenon. It is also an inhalational agent of choice for experiments.
thank you and thank you for watching.